Liverpool has the highest number of COVID patients in hospital in the UK, currently more than 460. That's 1 in 3 of their patients. Our medical editor, Fergus Walsh, has been given rare access to the doctors and the sick to find out how they're coping.
This is what happens when a city loses its grip on coronavirus.
I've never experienced pressure that's been even remotely like this.
I'm 58 now and I'm looking after patients that are my age or even younger than me.
The NHS risks failing the patients it's there to serve.
It is very depressing. If you're out there, if you need a new hip, if you're in pain, if you can't walk, no, we can't help you right now.
The COVID intensive care unit at the Royal Liverpool Hospital is at full stretch.
She's not synchronising.
Medical teams work non-stop to help patients struggling for breath. Like Douglas, who's 73, a former bus driver and crane operator.
I was doing okay, and then I suddenly went downhill.
The sealed plastic hood he's wearing enables oxygen to flow into his lungs under pressure.
It's a bit claustrophobic, but it's doing the job. That's all that matters to me.
He takes a dim view of those who downplay the seriousness of coronavirus.
All these people that go around saying it's a hoax, and you know, it's just like a bit of a bad cold and whatnot and everything. They need to get their head straight, because I have never, ever been so ill in all my born days. This is an absolute crippler.
Staff sickness levels are 3 times normal.
Right now, I think I'm happy with that.
Critical care now depends on nurses redeployed from theatres and on others like Marie, who've come out of retirement.
A lot of the NHS is working on goodwill. And unfortunately people are starting to get tired and exhausted now. So I don't know how much longer goodwill on its own is going to run us.
Along the corridor, another intensive care unit, this reserved for non-COVID patients. It's full.
I'm going to be struggling to look after patients who need intensive care who do not have coronavirus.
In the past week, around 10 critically ill patients have had to be transferred between hospitals in the region in the search for a bed.
We're hanging by a thread. It's quite tight. Each time a new patient comes into the emergency department, we have to reshuffle, so we all feel that pressure 24/7. This is winter plus. People are right to say that these are pressures that occur every winter, but this time it's just a lot worse.
The trust isn't helped by its ageing buildings. A new hospital was meant to open 3 years ago to replace the Royal and is still not finished. Its other big hospital, Aintree University, serves the north of the city. In both, nearly all non-urgent surgery has been cancelled. The staff are needed in critical care.
Normally at this time of day, all of these operating theatres would be busy and there would be a patient on this operating table having an operation.
Last month, 9 urgent cancer operations had to be postponed, some at the last minute, because there were no intensive care beds available.
Of course, it's devastating for the patient themselves if they've come into a hospital expecting to have a potentially life-saving cancer operation, and the morning of the operation they're told the operation can't go ahead, and that's devastating for the patient and for the staff looking after the patient.
Those cancellations are the exception. Most cancer care is continuing as normal, much of it at this new centre behind the Royal. David has lung cancer. This is his first round of chemotherapy. None of his treatment has been affected by coronavirus.
It's just been very fast, and all my appointments, none cancelled, everything's gone to plan.
And there has been progress with COVID-19. The chances of surviving have improved. Ventilators are used more sparingly. There are some proven drug treatments. But sometimes it's hard to focus on the positives when the patients just keep coming.
What we've seen here in Liverpool should serve as a warning to other cities, other communities across the UK. that unless we keep coronavirus in check, then the NHS will come under extreme pressure.
The Prime Minister says a lockdown in England is needed to prevent a medical and moral disaster. And those on the front line are pleading with the public to follow the rules.
The message is, if you don't listen to us, if you don't adhere to those restrictions, you will harm your friends, you will harm your family, your neighbours, and you might even harm yourself.
The NHS is about people, its staff and the patients it serves. It is a cradle-to-grave service for the beginning and end of life.
He's asleep.
For people like Harry King and his wife and carer, Diane.
Hello, sweetie. Oh, you look nice and comfy, don't you?
Harry is 75. He has late-stage Alzheimer's disease and COVID-19, one cruel condition compounded by another.
Everybody loves Harry King, don't they? Hey? Yeah.
Diane brings in old photos. Harry in his 20s in the army. Memories of a happy life.
That's right, the army, that's right. He's been a fantastic husband, dad, granddad. Aye. So it's hard. Very hard. Been married nearly 50 years in January. But we've done a lot of things that we've enjoyed. I think the virus has done it to him. Because his Alzheimer's was not this bad when he came in. He keeps asking, can he go home? But we can't because of the oxygen. Oh, no. Mike will come to see you soon, isn't he?
The couple's 2 grown-up children have been to hospital to say a final farewell to their dad.
Lovely, aren't you?
One family among the many thousands who face loss and grief in this time of coronavirus.
Fergus is with me now. Really hard to watch and terrible to see hospitals under such pressure again. But how different is the situation there now to what you witnessed at the peak earlier in the year?
Well, across the UK, Sophie, there are roughly half the number of COVID patients in hospital compared to the peak, and roughly a third of the number of patients on ventilators. But that doesn't tell the full story. In the first wave, intensive care units were dealing almost exclusively with COVID patients. Other people with serious health problems simply stayed away. That's not the case now. We have all the usual demands on the health service plus COVID, and we're going into winter, not coming out of it. Now, Liverpool is by far the worst affected city. Other hospitals are not postponing urgent cancer surgery. The government has said unless we go into lockdown, medical staff all over England will have to make hard choices about who to treat. That is already happening in Liverpool.
Our medical editor, Fergus Walsh, thank you.